Trust the Pulse for all your news analysis on the top issues of the day. Now, more than 3.5 million Ghanaian children are now trapped in poverty. That's according to a new report by the World Bank and UNICEF. Globally, nearly 385 million children are living in extreme poverty. Ghana was one of the first countries to meet the MDG deadline of halving the number of people living in poverty by 2015. But this new study now says efforts have slowed recently, with the income inequality gap in Ghana at an all-time high. Children the most affected, it concludes. Joy News Justice Bade has been studying the report and joins me in the studio to tell us more. Hello, Justice.
Hi, Aisha.
What are the key highlights of this report?
So some of these are things that we are used to already, and it touches on issues to do with health, with education, with nutrition, newborn care, maternal health, and all of that, and it zero into with issues related to children and the general situation in Ghana. So what we've been trying to do is to piece together some sort of infographics that will tell the Ghana specific situation. So right. You would see from the figures that there are roughly about 12 million children currently in Ghana, and with the current figure that says that 3.5 million could be described as poor, it comes down to about 1 in every 3 children. It sends a very worrying situation that requires attention. If you look at education, for example, on education, the report basically says that, for example, among other things, that 7 out of every 10 Ghanaian children in primary three could hardly read or write, and so it raises issues about the content of education that we are having for our children. So it praises the government and Ghana generally, for example, for increasing access to education through the increased number of school buildings and all of that. But then, what sort of content are we given to children once and that could lead to they are in school?
No
exactly
growth and
exactly because then
for the
a child who is
that's the end result.
Poorly educated, it has impact on how employable he is and how prepared he is to earn an income. On sanitation, for example, if you look at sanitation, it raises same old issues about the sanitation problems that we do have. So, for example, 1 in every 5 Ghanaians defecate in the open, and it comes with attendance problems, right, with increased debt, diarrhea-related deaths, for example. As it stands, the report says report says that 3,600 Ghanaian children die every year out of diarrhea, right, and these are diseases that could be easily prevented. So these are generally things that we know. If you talk of nutrition, for example, which is a key indicator for young children, especially between the day of birth and then their first birthday, and also sometimes to their 5th birthday. 1 in every 5 Ghanaian children are stunted, which means that they are not growing to the height that they are supposed to grow per the ages that they do have. And it's basically because they are not getting the right level of nutrition that will boost their growth. There are issues that you could ignore, but basically these are all issues that have been raised. If you look at one of the things that has been said, for example, in the recommendations that government should focus on, is to increase access to cash transfer. So, for example, projects that directly assist poor people, the poorest of the poor. Right. And in Ghana, one of the things that we know we've been doing is the livelihood empowerment against poverty. So government has been praised hugely for investing in the LEAP. But the problem with the LEAP as it stands in Ghana, for example, now, is that if you take every 10 of the poorest people in Ghana who are supposed to be on the LEAP, it's only 1 out of every 10 that are currently getting covered by the LEAP.
There's also been complaints of how much money
they are having and what they are using that money for. Actually,
recently was increased to 7 cities or something.
So basically, they all of these are issues about, yes, we are trying, but we need to do more and urgently need to do more. So there are wide-ranging issues about how poverty in itself among the children, the inequalities varying. So, for example,
the
if a
gap
child
must be bridged.
So there are concerns that the rich is getting richer